Hello, my name is Dr. Dennis Courtney, and I am the medical director of the Pittsburgh Eye Protocol. It's normal for me to be in contact with all of my patients who come to me for treatment of the various retinal eye diseases. And I always enjoy having the opportunity to speak to them when that opportunity arises. Well, such an opportunity occurred just within this last week, and I felt that it was so important that I wanted to have the patient speak to you so that you can assess how well she did and maybe envision yourself in that similar situation. So I have the opportunity today to introduce you to a patient of mine that initially passed through our program 4 years ago. And her name is Miss Lori Shad. And Lori, welcome. Nice to see you again. It's literally almost miraculous to think 4 years have gone by, and I haven't had a chance to meet with you, but just on the spur of the moment, we came into alignment last week, and you called in here, and we were just talking about you at the time. Now, to me, that's divine intervention, and it really necessitated why I felt I wanted to give you an opportunity to ask you questions about yourself, what has transpired since you left us 4 years ago, and the most recent and very interesting visit that you've had with your eye doctor. So, Lori, give us a little history about you. I understand that, by the way, your diagnosis was a dry macular degeneration. But in talking with you today, I learned that this was something that really was going on in your family, that your father did suffer from such a disorder. Is that correct?
That's right, Dr. Courtney. Yes.
So you literally grew up watching how destructive macular degeneration can be. You had a series of eye issues early on that dealt with the cornea, and it required you to wear very thick glasses. And you said you wore those glasses for some 30 or 40 years, okay? Quite a while. I notice you don't wear glasses today. Maybe we'll get into that very nice thing that occurred to you. However, with that said, 4 years ago, you attended one of our programs here in the office to restore your lost vision now, the 3-step program to restore your sight. And so I'm going to take you back to 4 years ago. You felt, if I remember correctly, that you were gifted enough that you could literally read your way by following the book that I wrote and sort of teach yourself. So your program wasn't a 3-day program. You cut it down to 1 day because you had confidence in yourself to be able to put this together. And so in 1 day, we did everything that we could to get you started. Once you left me that day, tell me a little bit about what you did on your own and have continued to do religiously for 4 years now. Go ahead.
Well, the first step is using the frequency-specific machine that I left with. Dr. Courtney provided that machine as part of the 1-day program. And I kept track of my protocol, which is with a little card so that I'd make sure I would rotate through the program properly. And I read the book, and eventually I got a PEMF device that was recommended. He recommended supplements. He recommended how to correct your nutritional deficiencies. I found that I had some mineral deficiencies. So through his program, I did correct those, and I'm continuing to do that now. Another step in the program is removing toxicities. And we all get them. I think that wasn't my major problem. I knew about nutritional deficiencies and toxicities before I took the program. But for me, the major step was step 3, optimizing perfusion. I didn't even know about perfusion. But by doing the FMS machine and the PEMF mat, I think that was what really optimized perfusion to put me into a path that led to eventually, after 4 years, my eye doctor, who diagnosed the dry age-related macular degeneration, could not even find it. My last doctor visit with him a few weeks ago.
A few weeks ago. By the way, so the audience isn't confused. PEMF is a very important component of what we do, but I think the people listening never heard of PEMF. So let me at least say PEMF stands for pulsed electromagnetic fields. And this is one of the arenas of pursuit that allows us to increase blood flow to your retina, as well as to other parts of the body. And it is true that pulsed electromagnetic field treatments, as well as FSM, which I believe is another term that the audience would necessarily understand, it stands for frequency specific microcurrent, are the two big components that allow us that perfusion to be increased to such high levels that tissue can be restored and come back to health. And as long as I've been doing this work, and I've been doing this work for many years now, I'm yet to find anyone report back to me that their eye doctor had told them, you know what, you remember that macular degeneration that you had? Well, I've just examined you and I find no evidence whatsoever that you ever had it. And I thought that was such an amazing encounter that I just had to share it with an audience who might be sitting there right now wondering, gee, should I do this program or should I not? And stories like yours, by the way, I'm sure have happened before, but no one's ever come to me and told me that. And everything was in alignment. Your phone call to me, while I was thinking of you anyway, just made this necessary. Are there a few words that you want to leave the viewer with today? Some advice, something you want to pass on to them as we close that you think might be helpful in allowing them to make a similar decision?
Yes, I do. I think that healing is not a one quick fix. Dr. Courtney's book outlines an integrative approach. It's not just one thing. It's not just the frequency-specific microcurrent machine. It's not just the pulse PEMF machine. It's a way of life. It's going to help you not just with your particular eye problem, but with your whole body. Because when you eat right, think right, remove your toxicities, it does a world of good for the whole person. So he has a whole approach to healing. And if you do this program, it only works if you actually implement it in your life. You have to have the discipline to follow it. And it's a daily thing. It's a way of life. But it's worth it.
Lori, thank you so much for allowing me to interview you today. I think those that view this will feel pretty good about themselves and the decision that they're making. And I just want to thank you for allowing me to spend a little bit of time with you to enlighten many others. Thank you very much.
I want to thank you too, Dr. Courtney, for what you do to help so many people.
Much appreciated. Enjoy our meeting. Ladies and gentlemen, good luck.